Good day, ladies and gentlemen. Welcome to today's webcast entitled Enrollment Assistance Programs and Funding Opportunity for Navigators. To submit a question or comment at any time during the webcast, please click on the Ask a Question button on the bottom of your screen. Simply type your message into the box and click on the Submit button. At this time, it is my pleasure to turn the floor over to Amy Smucha. Ma'am, the floor is yours.
Thank you, Kara. I'm Amy Smucha, Field Director for Families USA, and I'm excited to be moderating this call with you, advocates and policy professionals throughout the nation, to discuss the funding opportunity for Navigators that was announced last week by the Centers for Medicare and Medicaid Services, as well as recent proposed standards for this program and other federally funded assisters. The funding opportunity announcement, which was featured in the email announcing this call, provides an opportunity for organizations and individuals to build up capacity to help newly eligible people learn about and enroll in health coverage through federally facilitated marketplaces that will operate in 34 states beginning this fall. Today we will be joined by two amazing speakers, Elaine Sally, Health Policy Analyst here at Families USA, and Vicki Gottlich, Director of the Consumer Support Group at the Center for Consumer Information and Insurance Oversight. Just a couple quick housekeeping announcements. We are going to leave time for questions at the end of the call, and you can also submit questions through the webinar interface. And this is an off-the-record call. In an effort to encourage an open discussion by all, I would like to remind all participants that this call is off the record to the news media. So we're going to start a little bit with the big picture and the opportunity to really set up effective enrollment programs. We'll start with Elaine. Elaine, tell us about the types of enrollment assistance programs that will help consumers enroll in coverage through the new health insurance marketplaces.
Thanks, Amy, and hi to everyone on the call. Thank you for joining. Next slide, please. This is just an agenda for today's call. We're going to talk, as Amy suggested, about the types of enrollment assisters, then the proposed standards, the federal Navigator grant opportunity, and then we're going to talk with Vicki Gottlich from CSIO. So just to provide some context before we talk about the different types of enrollment assisters, enrollment assistance programs are part of a larger consumer assistance structure, as many of you know, for the health insurance marketplaces, also called exchanges. The components of the consumer assistance in marketplaces are the consumer-friendly website through which consumers will find out about their coverage options and will enroll in coverage if they're applying online. The call center, which will be operated by HHS in states with federally facilitated exchanges and will be operated by states that run their own exchanges. And this will provide assistance for consumers with general questions, but it will also provide a way for consumers to enroll in coverage on the phone. And then there are the enrollment assistance programs, which are the focus of this call, and those include navigators, in-person assisters, certified application counselors, and insurance brokers and agents. Then there are also the very important referral programs and agencies that help consumers with more complicated issues, such as help with consumer assistance programs and legal services programs that help consumers with appeals and complaints and help consumers when they have difficulty using their coverage. So Navigators, I know you all are familiar with this program on the phone, but I just wanted to provide a definition that we can use, which there are people or organizations that will help consumers and small employers learn about and enroll in coverage through the new health insurance marketplaces. We know that they're required in all marketplaces and that they have to be prepared to help all consumers throughout the service area that the marketplace serves, including small employers. There are many types of groups that can be navigators. These include community-based organizations, trade and professional associations, partners of small businesses, Native American tribal associations, and others. There have to be at least two types of navigators that are chosen in each exchange service area. and that at least one of those has to be a community or consumer-focused nonprofit. They have to have existing relationships or be able to readily establish relationships with populations that are likely to be eligible for enrollment and coverage through the marketplace. And that's really one of the most important things that these groups bring to the table is those existing connections, and they can target their services to specific populations or geographic areas. And they cannot have a conflict of interest, meaning that they cannot be a health insurance company, a subsidiary of a health insurance company, an association that includes members or lobbies on behalf of an insurance company, and they cannot receive payment or funding or other types of consideration from a health insurer in connection with enrollment in a qualified health plan, those health plans that will be sold in marketplaces or in health insurance plans outside of marketplaces. Oh, I'm sorry. Go ahead. Yeah, next.
8.
Yeah, 8. We know the basic functions of Navigators, that they'll maintain expertise in eligibility enrollment and the process for gaining coverage through the marketplaces, that they'll raise awareness of the marketplaces and distribute fair, accurate, and impartial information on all of the coverage options that are available to consumers, including public coverage options, that they'll facilitate enrollment in a qualified health plan, meaning they'll take consumers through the full process, both of the application and also of understanding their options as they're selecting a health plan. They'll provide culturally and linguistically appropriate services and services that are accessible to individuals with disabilities, and they'll make referrals for assistance that's outside of their scope to those referral programs that I discussed before, consumer assistance programs, legal services, state agencies that can help consumers with more complex issues. What do they need to know? These are the core areas of training for navigators. They need to be trained in the needs of underserved and vulnerable populations, eligibility and enrollment rules and procedures, the range of private health plans that are available through the exchange, and the cost assistance programs, premium tax credits, and cost-sharing reductions that are available to consumers to help make their coverage more affordable, and also public coverage options. And they'll have to learn about privacy and security standards. The new guidance that we'll talk about later in the call provides a lot more detail about the training for navigators, how they're building on those core topic areas. So next, I'll talk about in-person assistance programs. Those programs will generally provide the same services as navigators, but the key difference is that they'll operate only for the first year in which exchanges are up and running, and that they'll be funded through exchange establishment grants. That funding that has been available to states in order to establish the functions of exchanges. They're required for states partnering with the federal government to provide consumer assistance. Those federally facilitated exchanges that have decided to take on that additional role of helping the marketplace, helping HHS to deliver consumer assistance in those federally facilitated exchanges. And it's an option in state-run exchanges, though we know that all state-run exchanges are taking advantage of this opportunity to use establishment grant funding so that they can provide consumer assistance until their exchanges become self-sustaining, meaning they're raising revenue through their exchanges that can help to fully fund a fully operational Navigator program. They also have to complete training and comply with federal standards, the same standards that navigators will comply with in federally facilitated exchanges that we'll talk about a bit later. The next program is the Certified Application Counselors program, and again, these Certified Application Counselors will generally provide the same services as navigators. They're not expected to do as much outreach because this program is meant to build upon those places where this type of enrollment assistance is already available, such as in hospitals and through community providers who are already providing enrollment assistance in many cases. Also, Medicaid application counselors those programs are operational in many states. So this program provides a way for those types of entities to get the training that they need to provide assistance with enrollment for the new marketplace. And again, they're optional in the Medicaid program. these rules are proposed, so we don't know what the final standards will be yet, but for now they're optional for the Medicaid program. Medicaid programs can decide to designate certified application counselors, and they're required in marketplaces. So we know that they will be operational in all marketplaces. In order for certified application counselors to help a consumer to enroll in coverage, they have to register with the marketplace or the Medicaid agency, receive training, and obtain certification. They have to disclose information to consumers because conflict of interest standards are not as strong here. We want to make sure that consumers understand the relationships that these certified application counselors may have with insurance companies. They have to, but importantly, they have to provide assistance in the best interest of consumers, meaning that even if they have relationships that could cause a conflict of interest, they have to tell consumers about all of their coverage options. And, of course, they have to comply with privacy and security standards. There isn't any federal funding for certified application counselors. Through the federal government, a state may be able to provide certified application counselors with Medicaid funding, for example, if they're helping consumers to enroll in Medicaid. The last category of assistance that I'll talk about are insurance brokers and agents. This is a state option to allow insurance brokers and agents and help consumers enroll in these coverage options. In order to do that, they have to register with the marketplace. They have to complete training because these new coverage options and the enrollment process will be new for everyone. And they have to comply with privacy and security standards. When they're helping a consumer to enroll in the marketplace, they also have to use the marketplace enrollment portal, and that's really important because this enrollment portal is the way that consumers will make sure that their eligibility has been assessed for all coverage options and for all financial assistance that they may be eligible for, including premium tax credits and cost-sharing assistance. And, of course, brokers and agents can be navigators, but they have to comply with privacy. They have to comply with conflict of interest standards, meaning that they can't receive compensation from an insurer or direct or indirect consideration from a health insurer in connection with enrollment work.
Great. Thank you for that overview, Elaine. Just a quick check-in. We're not yet moving on to the portion of the call about funding, but I just wanted to briefly welcome Vicki Gottlich, who has joined our call. And Vicki, your line is live, so you may want to mute it, and we'll be ready for you in just a few minutes. But thank you for joining us today. So we'll move on to a couple other questions for Elaine. Even though these different types of assisters will provide essentially the same services for consumers on the ground, there are some differences, both in the funding streams available for these programs, but also in terms of standards set in guidance from CMS. So before we turn to that discussion of funding, let's talk a little bit about the new guidance on standards for navigators and other assisters. Elaine, help us understand just kind of top lines of the recently released guidance and to whom it applies.
The proposed federal standards were released last week on April 4th, and they're open for comment. So these are proposed standards, and groups can comment through May 6th. The standards apply to navigators in states with federally facilitated exchanges, including partnership states, so all of those states in which the federal government will be establishing navigator programs, and they also apply to in-person assistance programs, which are called non-navigator programs in the guidance, that are funded through establishment grants. So we know that those in-person assistance programs are operating not just in partnership states in which the federal government is establishing the marketplace, but also in states that are running their own exchanges that are taking advantage of those federal dollars to create these in-person assistance programs in the first year. This guidance does not apply to navigators in states that are running their own exchanges, but of course they can use this guidance to help inform the development of their program. And comment is explicitly solicited on whether these conflict of interest training and other standards should apply to application counselors. So I've flagged the major changes in these in these regulations on the next few slides, but just in the interest of time, we'll provide kind of the top lines. So the guidance addresses state-specific requirements. States may develop, all states, including those in which the federal government is operating the marketplace, can establish licensing, certification, and other standards for navigators and assisters, but these requirements can conflict with federal law and guidance, and the new guidance says that they also cannot impede implementation of the marketplaces, meaning if these standards are too burdensome or, for example, navigators or assisters are charged fees by the state that they are not able to pay while still carrying out their duties, while still using the funding that they'll get from the federal government to carry out their duties, those would be considered situations in which those standards are impeding implementation of the marketplaces. The guidance outlines conflict of interest standards. In essence, it really reinforces the standards that we already have for navigators, but it adds one more category of insurers to those that would have a conflict of interest, and those are stop-loss insurers. Issuers of stop-loss insurance or subsidiaries of issuers of stop-loss insurance, and stop-loss insurance is a type of insurance that can be purchased by employers that self-insure to pay for their employees' health coverage, meaning that they effectively act as their own insurance company by paying covered medical expenses of their employees out of pocket. And the stop-loss insurance policy puts a ceiling on their liability for the healthcare expenses of their employees. So those in navigators cannot be stop-loss insured. All those same conflict of interest requirements that apply to health insurance companies apply to insurance companies that sell stop-loss insurance. Importantly, it also describes how navigators and other assisters will comply with conflict of interest standards, that they have to submit a plan to remain free of conflict of interest, and that they have to disclose information to the exchange and to each consumer about relationships that they have that could cause a conflict of interest. The proposed rule also outlines training standards. It outlines 15 major categories of training that will be required, and these include the core areas required in the statute that we outlined earlier, and provide more detail about the topics that need to be covered in the training curriculum. For example, they include training requirements on how to help consumers understand how a private insurance plan works, how to understand the differences between health insurance plans, the tax implications of enrollment in premium tax credits, and other topic areas like that. They approximate that initial training should be approximately 30 hours, and they also require continuing education. They explicitly describe that all navigators and assisters must complete the full training program. So this is an HHS-approved training program, so it can be the training program that they are creating for navigators that are operating and assisters that are operating federally facilitated exchange states, and they have to approve of the training that's being provided to these navigators and assisters in states that are running their own exchanges. And so navigators and assisters have to complete all of that training, and they have to achieve a passing score on certification testing in all of the areas of training. And annual recertification is also required. I think it's important to note all of these areas of training because we know that within certain assister and navigator entities, staff may be specializing in certain areas, but they still are required to complete all of the training. The next two chunks of the guidance address cultural and linguistic accessibility, and they provide more detail about what it means to provide culturally and linguistically appropriate services, that the navigators have to maintain knowledge about the demographics of the area they're serving, that they have to collect information to make sure that they understand the languages spoken by those demographics. And they have to provide interpretation services at no cost, and they have to implement strategies to recruit and support staff that represent the demographics of the area they're serving. The last area is access for individuals with disabilities, and again here the proposed rule outlines that outlines that what it means to provide accessible services in this area, and that means that materials and websites and tools are accessible, that they're providing assistance in physically accessible locations, that they provide access to auxiliary aids and services at no cost, and that they have knowledge to provide referrals to services for people with more complicated needs.
Great. Thank you, Elaine. And I know folks on the phone are really eager to get to the topic of the federal funding opportunity that we're going to talk about next. I wanted to assure people that even though there's so much amazing information that Elaine outlined, that we are going to send you a follow-up email, not only with Elaine's slides, but with more information about what both Elaine and Vicki will be talking to us about. And we'll have an exciting announcement later in the call about a resource center that we intend to launch to support your work throughout the coming years on these important issues. So I'm going to turn the call now over to Elaine to both talk a little bit about the federal funding opportunity for Navigators, but also then to pose some questions to Vicki Gottlich, who has joined us from the Centers for Medicare and Medicaid Services.
Thank you. And I want to also flag that we are going over we wanted to provide information about the new guidance, of course, not just because it's come out so recently, but also because it's helpful in helping navigators and assister entities, those that are interested in applying to be assisters through their state programs and to be navigators through the federal funding opportunity, to understand what's going to be expected in terms of the services that they provide and the training and conflict of interest standards that they have to comply with. So with that, we'll talk a little bit about the funding opportunity and then ask Vicki some questions. The funding opportunity was released just last week on April 9th, and it requests letters of intent from those entities that are interested in applying by May 1st, and we'll ask Vicki a little bit about how those are going to be used. And then the final proposals will be due on June 7th. There is $54 million in funding for 34 states to establish Navigator programs, and the amount that is available to each state is based on the number of uninsured in that state. The grant funding is for 1 year, and HHS expects that they will award grants by August 15th. The funding opportunity announcement provides some guidance in its narrative about for applicants that are, for those that are interested in applying. It says that small entities or individuals that are proposing to serve smaller, hard-to-reach, or underserved populations are encouraged to form a consortium to apply for the grant funding. So they are encouraging these types of smaller entities, but even those that are operating in the same region or that are serving the same population to partner by applying as a consortium. The proposed grant also says that when an applicant is applying and they specify their budget for these services, that they have to be proportional with the number of uninsured in their service area or in the population that they're serving relative to the total uninsured in the state. So they want to make sure that, so not only is the funding for the whole state based on the number of uninsured, but the funding for individual grantees is also based on the number of uninsured that the grantee expects to reach. Again, with this emphasis on making sure that all populations in geographic areas have access to Navigator services, and that these entities are, their aim is to reach as many uninsured as possible. The proposals that serve more uninsured will be given a priority over those that are describing activities, for example, that are describing activities to reach a smaller population, even though we know that some populations will be harder to reach than others. The funding opportunity announcement outlines requirements for grantees. It explains, and this is something that we weren't sure about before, and it's very important that all grantees and sub-grantees have to have an employer identification number or a taxpayer identification number, and have to register with grants.gov to obtain a data universal numbering system number, that DUNS number, and also to take other steps that are required in the registration process. That's required for all sub-grantees, even if you're applying as part of a consortium. You also have to be prepared to assist any consumer, even if they're not part of the population that you're targeting, but you can provide referrals to other entities in order to serve those consumers. The Navigators have to complete 30 hours of HHS developed training. So in these federally facilitated exchange states, HHS is developing and delivering training, and they have to pass the certification exam that HHS is also developing. The grant opportunity describes some supports that will be given to Navigator entities, including that a project officer will be assigned to each grantee, and that project officer will help the grantee to meet requirements, and they'll also conduct monitoring. And each Navigator entity has to submit quarterly and final reports in order to draw down funding. Just the last thing that I'll flag about the funding opportunity announcement is that it includes a checklist for required components of the application, descriptions of each component, and scoring criteria for each part of the proposed of the grant proposal. And I think that those are very helpful areas to look through carefully. Of course, as you're developing those proposals, or even encouraging your networks to take advantage of the funding opportunity. So now we'll talk with Vicki Gottlich. Hi, Vicki. Welcome to the call.
Hello. How are you?
Well, thank you. How are you?
Good.
So we wanted to talk with you to ask some specific questions about the funding opportunity. And one general question I just wanted to start out with is, what are some of the most valuable characteristics that you'll be looking for in evaluating a Navigator grant proposal?
We're going to look for diverse entities. We're going to look for entities that can serve a variety of uninsured populations. Since we all come from the public interest community, we often think of the most vulnerable populations, but there are populations who we don't generally think of as vulnerable, who are uninsured, who we'd like to help get enrolled in health insurance coverage. People who, maybe at 150% of poverty, 200% of poverty. So we're looking for organizations that can serve diverse communities and that understand the communities that they're going to serve, understand enrollment. We're expecting that not everybody will be insurance experts, and that will be included in the training.
Thank you. And as we mentioned, the funding opportunity encourages organizations to apply as part of a consortium. Can sub-grantees that are part of that consortium focus on particular duties?
Right, yes. As long as the overall grantee can perform all of the functions, then sub-grantees can focus on particular functions. So if you've got a consortium that's going to serve an entire state, maybe some of the sub-grantees will serve one portion of the state and others will serve another portion, or some will focus on one population and others will focus on another population.
And in terms of the duties that are required of navigators, and specifically, concretely thinking about outreach and enrollment assistance, can the navigator sub-grantees specialize in one or another of those areas?
Yes, they can. It's important to make clear, and we've had questions about this, that all navigator individuals who are going to be navigators must complete all of the training. So if you've got one large grantee who's got, say, 4 sub-grantees, and some are only doing outreach and some are only doing enrollment assistance, all of the people working under all those sub-grants would have to take the entire training and be certified as a navigator.
And if the service area served by the consortium is large, will you be looking for specific plans or strategies or ways of structuring a grant application that can demonstrate that both outreach and enrollment assistance will be accessible to all of the populations in the service area?
Yes. The Navigator grantee has to perform all of the functions. We are not putting a priority on one function over another function, so the grantee has to be able to demonstrate that the consortium can perform all of them and equally.
Thank you. What is expected of an organization that serves as a lead applicant to continue in that vein, that applies on behalf of a consortium?
Well, the grantee is going to have to make sure that all of the navigators are receiving the training and certified before they can start doing the work, that the navigators comply with, all the individual navigators as opposed to, the entity, comply with the requirements of the grant, and that the reporting requirements are met.
Thank you. And how will SOCIO use the letters of interest that are requested by May 1st?
Those letters are not binding. We really wanted letters, quite frankly, to ensure that there is interest throughout the country. So if we find we're not getting letters of interest from a particular state, we might be doing additional outreach in that state to ensure that we have grantees from that state, or if we know that there's a particular population that may not be reached in a state, we might try and do some outreach to ensure that that population is reached.
That seems related to the two-tier process for distributing funding that's described in the funding opportunity announcement. It says that there'll be two tiers of funding. Can you explain how the phases of that process will work? I'm
not sure what page you're on, Elaine. I'm not sure what you're talking about.
Okay, maybe we can go into the funding opportunity announcement if others have questions. But it says that first there'll be, I guess maybe that is kind of connected to this use of letters of intent to establish that certain entities will apply, and then it says that I think those monies that are not distributed to initial applicants will then be pooled to kind of do that outreach that you were describing.
Yeah, I'm not quite sure that's how it's going to work. So we should probably move to a different question.
Okay. What types of support resources will be available to navigators once they begin to serve consumers? How will they communicate with the marketplace? What other types of support?
Each Navigator grantee will be assigned to somebody on my staff who will provide technical assistance to them, who will provide oversight of the work that they're doing. We're talking with states now so we can do some coordination, particularly in states that are going to have in-person assistance programs or, certified application counselors. We want to ensure that all the resources are working together. We want to ensure that outreach that the state does on its own or with CMS's Office of Communication is coordinated with the work that the navigators are doing. So there's going to be a lot of coordination among states, CMS, various components of CMS, and the navigators. And then we want to ensure there's communication among the navigator grantees themselves to talk about best practices or issues that are arising.
Thank you. Those are really important resources. Specifically, in talking about coordination, how will navigators interact with the federal call center?
So Navigators will call the call center. At the moment, there's not going to be a direct line, but if a navigator calls the call center, they'll get sent to the head of the line, is what we're thinking at the moment.
And what kinds of assistance would they be able to receive from a call center representative?
So the call center, we're hoping will provide, if there's, an IT issue, the navigator is working with somebody and the computer system isn't working, or the call center may be able to assist with resources or other information.
And that's different from the technical assistance. Can you describe how that's different from the technical assistance that will be provided directly through CSIO?
Yeah, the technical assistance through CSIO will be operational. And if a navigator has some really thorny questions, that might be a way to get the questions answered.
Thank you. That's very important. My last question is, what approach would you recommend that states take in supplementing federal training, monitoring, and program standards? We talked about the guidance earlier in the call and the fact that states can develop standards and requirements on top of the federal standards and requirements. Where do you think states need to be doing that, and what approach do you think would be most effective?
The big example that I always give is state Medicaid laws. Our training is going to be talking about MAGI and Medicaid generally. It's not going to be talking about all the Medicaid eligibility programs in each of the states in which we're going to be awarding Navigator grants. And same thing with CHIP. There may be particular other state insurance affordability programs that the state might want to talk about. State might have different conflict of interest requirements, so the state training might want to go there.
And do you have any recommendations for how that state training should be delivered, or how states can make sure that they're, that what they're developing is compatible with HHS's process in any way?
We've been talking to the states, talking to them about what we're intending to include in ours. The states, it's sort of hard to say here is the way you should do it, because each state is thinking of a different approach. So we're kind of giving the states the flexibility to design the systems that they think work best in their state. Mm-hmm. Our training is going to be an online training. We think that works best, given that we have to reach all over the country, Florida to Alaska. But, in a smaller state such as Delaware, for example, they may be able to do in-person training.
Thank you. So we'd now like to open the call up for questions.
Yes, thank you, Vicki, so much for those helpful insights. This is Amy Smucha, Field Director at Families USA, and I'm going to try to coordinate some questions here. First of all, Kara, will you tell folks on the phone if they have not submitted a question through the web, how they can get in the queue to give us a question?
Certainly. The floor is now open for questions. If you do have a question, please press star 1 on your telephone keypad at this time. Questions will be taken in the order that they are received. If at any time your question has been answered, you can remove yourself from the queue by pressing 1. If you're using a speakerphone, we ask that while posing your question, you pick up your handset to provide favorable sound quality. Again, ladies and gentlemen, if you do have a question, please press star 1 on your telephone keypad at this time. Please hold while we poll for questions.
Thank you so much. And while we're waiting, just a couple of announcements that we want to make sure we make. We're very excited to announce a new resource center relating to navigators and in-person assisters that will shortly be available on the web. We know that there are many resources and types of support that the navigators and assisters and all of your programs will need to be prepared to help consumers through the new eligibility and enrollment process. And our new resource center will provide a hub where we can post tools that can help navigators effectively counsel consumers, share best practices, and provide updates on new information and guidance from the federal government. We welcome your ideas about what types of resources would be most useful as you're building enrollment assistance programs in your state. That information will, there's a link at the Families USA website at www.familiesusa.org, and we will also send information about that new resource center and how you can subscribe to it by email just a little later this week. One other thing to let you know is that Families USA's field staff would welcome your emails giving us updates on what's happening in your state and how you're gearing up for enrollment opportunities. So we'll use that information to support your work and create health policy papers and tools, and we're available to provide technical assistance to state advocates. To send us any information or updates or to request assistance, you can always email us at field@familiesusa.org or stateinfo@familiesusa.org. So now we're going to pitch, Vicki, a couple of questions we got on the web, and then we'll move to the phones. So, Vicki, we have two questions about entities providing assistance. One's pretty straightforward. The question is, if we as a nonprofit receive grant funding from an insurance company, are we excluded from being a Navigator site?
Okay, it depends on what the grant funding is for. If the grant funding is to help enroll individuals in qualified health plans or other insurance, then the answer is yes, you're precluded because Navigator grantees cannot receive compensation directly or indirectly for doing enrollment in qualified health plans or other non-qualified health plans. If you get a grant fund or get money because they support your fundraising walk, or you get money, grant money to do publications, probably not.
Thank you. One more from the web, from one of our partners at a legal service organization. Will it be appropriate for navigators to assist individuals in completing Medicaid application processes or to help family members, for example, children, complete Medicaid application processes while they're helping the parents complete insurance enrollment and premium subsidy applications? So can we effectively commingle Medicaid assistance and marketplace assistance?
Absolutely, and it's all going to be one application. So you're going to put in one application, and the application may come back and say the children are eligible for CHIP, the pregnant mother is eligible for Medicaid, and the dad is eligible for a premium tax credit and should pick an insurance plan through the marketplace.
Wonderful. Thank you. So I think, Kara, will take the first question from the phone now.
Okay. Our first question is from David Ruse from Covering Kids and Family. Please state your question.
I want to pick up on the last comment that Vicki made, and that is there are a number of organizations around the country, including Covering Kids and Families, that have offered enrollment assistance for Medicaid, CHIP, and other public health coverage programs. There, quite honestly, isn't going to be enough money available through the Navigator grants to fund all of the outreach necessary to get eligible but uninsured children and families enrolled. So are there ways in which one can legally tap into funding that is currently available through state Medicaid and CHIP programs to provide that outreach and enrollment and layer on top of it funding through the Navigator grant program?
Yeah, there are rules about supplanting funds. So if you're getting Medicaid funds to do certain enrollment, you can't use the Navigator funds to do the same kind of enrollment. But if you're, say, a Medicaid outstation worker in, kids, I'm going to say, family court, but you say I'm going to be a Navigator program to work in these 5 elementary schools, that would be a way to do it.
So what I hear you saying is you need to carefully segregate the activities with the funding streams that support them.
Absolutely.
Thank you very much.
Thank you, David, for your question. We'll go ahead and take another question from the Internet, and I think this is probably a question for Elaine, for starters. What kinds of training or certification do you suggest for Navigators versus the other types of entities that will be doing consumer assistance? And then what suggestions do you have for states whose legislatures are right now considering legislation dealing with the training and certification process for assisters?
Thank you for that question. I think that, and Vicki can speak more about this, that all types of assisters will need training in similar topic areas. So the differences, I think, are very small in terms of, for example, with certified application counselors, it may be that they're not learning as much about outreach strategies because they're providing assistance in a hospital or in a safety net clinic, a community health center, but in all of the other areas in terms of helping a consumer to understand their coverage options, including the affordability programs and public coverage options, and get through the application process and receive an eligibility determination, all of those needs are the same. So I would say that I would actually just turn it over to Vicki before responding to the last part of the question to ask, how are you managing how those different types of assisters are getting training in the federally facilitated exchange states?
What we're probably going to do is tailor the training, so there are some portions of the training that in-person assistance personnel won't need. For example, they won't need the portion of the training that has to deal with the grant reporting requirements and what it means to be a grantee. The certified application counselors, in the proposed rule, we don't really see them doing much outreach, so they will not necessarily need to take the outreach portion of the training. Otherwise, the functions will be pretty similar, so everybody will need basic training on what's health insurance, how do you access the exchange, what are the affordability insurance programs, so it'll be pretty similar.
And I think with respect to the second part of the question, these legislative bills, I think many of them, there are many kind of purposes behind them, but I think the federal guidance is really helpful in answering some questions, and I think providing that new information to state legislatures that are considering these bills may help in terms of saying, establishing that HHS is taking on certain functions. For example, they're providing the training and certification, they're doing monitoring, and that the state doesn't need to implement duplicative requirements or processes, and also that part of the guidance I talked about earlier, in which that says that states, although they may develop these requirements, they can't be overly burdensome or impede the implementation of these programs. I think that states need to think about what their, how Navigator and assister entities will reasonably comply with the process that they're putting in place, and be able to be fully operational in time to help with open enrollment on October 1st. Vicki, would you say anything else about the state bills that we're seeing?
Yeah, I mean, we are, in our conversations with states, are saying, how are you going to interpret this and implement these bills in such a way that the Navigator can meet both the state requirements and the federal requirements? And I think with regard to training, there's an issue of cost for the state. Like, how much is it going to cost the state to build the training? So why spend the money to duplicate something that HHS is going to be doing?
Very helpful. Thank you both to Elaine and Vicki. We'll take another question from the phone and then return to the web. So, Kara?
Okay. Our next question is from Tila Wislow. Please state your question.
Hi, can you hear me?
Yes.
Okay, so I'm getting back to the consortium. I'm from Massachusetts. They're putting out a state Navigator program grant. So what needs to happen is there needs to be some overarching entity that takes responsibility and then can choose to include various groups who specialize in different areas as sub-grantees?
The FOI, the funding opportunity announcement that we've been talking about on this call is federal one, so I'm not familiar with what Massachusetts is requesting in its requirements.
Okay, but assuming it's not that different. So I'm just trying to understand operationally, like there would be one grantee who is the overall responsible person, and then other sub-entities could do pieces of the work, would have to get certified, meet all the requirements.
We can't really speak to the Massachusetts grant without looking at it.
Okay.
Okay, but one other thing that I want to say as well, we're not saying that going in the federally facilitated marketplaces, we're not saying that a consortium is the best approach, and we do want to encourage individual organizations that want to submit a grant on their own to submit that application. And even if it's a grant to say, I'm going to serve a population in a small corner of the state because it's the population with which I'm most familiar, and here are the reasons why I think I can do a good job doing it, then that's a grant application that we would encourage.
Okay. Thank you.
Thank you so much, Vicki, for clarifying that. And I just wanted to clarify, too, in response to the last question, that this funding opportunity, and I think you were asking about kind of models of structuring funding, but this funding opportunity is only open to entities that are applying for Navigator grants in states where the federal government is operating the marketplace, including those states that are partnering with the federal government on certain components of the marketplace. And just that, please do email us at state info. We know that other states are also have their requests for proposals out. State-run exchanges also have their requests for proposals out to provide Navigator funding for the programs that they're running, and can provide recommendations and some approaches from other states.
Thank you for that clarification. So, Vicki, we're going to pitch another question from the web to you. In the funding announcement, the proposal says that an applicant is eligible for only one non-renewable one-year cooperative agreement. The questioner says that's on page 7, section 11.2. Can you comment a little on that provision and what it means for the likelihood or potential for getting funding in subsequent years?
This is a one-year grant. We all know what the funding situation is. We expect there to be additional funding in future years because we know that navigators are an essential function of the exchange. That's about all that I can say. Can I guarantee that somebody who gets a grant this year will be automatically renewed for the following year? I cannot.
Thank you. Thank you for that's helpful. Kara, we'll take another question from the phone.
Okay, our next question is from Monica Viegas-Piedon. Please state your question.
Hi, I'm calling from Legal Services of Greater Miami. It's kind of a two-part question. If we envision that we would be part of a consortium, but as a sub-grantee, should we be submitting our own letter of intent? And two, if we do intend to be a sub-grantee, but there seems to be a couple of different potential partners at this early phase, could we be seen as partnering with them, even if that's worked out in the end in the application phase?
So letters of intent are not binding, so you can submit your own letter of intent or you don't have to. And what I do want to say is this is going to be a hard decision for a number of organizations where they know that there are a number of consortiums being formed in their community because you really can't get more than one grant funding, so you can't apply individually and be part of a consortium. You can't be part of two consortia, unless the work is going to be really different. Like if, you're going to do funding in, one grant is going to do Miami only and another grant is going to do Key West only or something like that.
I see. And the federal government or whoever's handling the application process wouldn't be, I'll use a bad term probably, but marrying agencies based on applications thinking, they didn't apply together, but this might be a good match?
Yeah, we are not going to be doing that.
Okay. Thank you.
Yeah, and thank you for that question because that clarifies a lot, I think, for folks who are thinking that we might be able to pick and choose and say, this is a strong sub-grantee and we're going to put them with these other strong sub-grantees and make a whole new entity to be the Navigator. We're not going to do that.
Great, thank you. So we're running close to the top of the hour. Elaine's going to give one more clarification from a group of questions we seem to get about providers and serving in this capacity, and then we'll resolve the call.
There are a lot of questions, and I want to say that we'll be looking at these questions closely after the call and can also send out answers to the questions, and please do also send your questions after the call. The questions that we're getting about providers are about conflict of interest for providers, and I wanted to clarify that, as Vicki said, it's about how the funding that a provider is getting from an insurer is being used. So if it's being used for medical services or for other types of services that are, or to hold health fairs, for other types of services that are not enrollment, then it does not count as a conflict of interest, although they do have to disclose that information to the consumer and to the marketplace as described in those standards. Is that correct, Vicki?
Yes, that's correct.
Wonderful. Well, one last time I wanted to announce that we will have a new resource center specifically for navigators and assisters and those folks who are building those programs in the state. You can find that information at the Families USA main webpage, www.familiesusa.org. I'd also like to thank Vicki Gottlich for joining this call and Elaine Sally from Families USA for giving us so much helpful information. This is an incredibly exciting time for the country as we're getting close to actually going out and enrolling people in health coverage, including folks who haven't had health coverage for years and years or possibly ever. And this information is critical for us to gear up for that capacity and to do a good job as we're doing it. So thank you, Vicki, very much, and thank you, Elaine. Please send any questions you have that haven't been answered or submitted to stateinfo@familiesusa.org, and look for new information with an email later this week. Thank you.
Thank you.
Bye.
Thank you, Vicki. Thank you, everyone.
Thank you. This does conclude today's webcast. We thank you for your participation. You may disconnect your lines at this time and have a great day.